Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe to my channel and also please give your valuable comments. You can also visit the playlist. In the playlist, I have provided almost all the topics in a very systematic order. I hope this will be very convenient for the continuous study. My dear friends, we have been discussing about the importance of the head size. We have covered it in two parts. In the first part, we have given the basics. In the second part, I have explained the microcephaly. Now, today we will see the clinical importance of macrocephaly. Macrocephaly means more than 97 percentile of the head growth and as well as more than 2 standard deviations. Now, many of the babies with the macrocephaly, just like microcephaly, will also have the developmental delay, as we discussed. Just like microcephaly, in the macrocephaly also there is developmental delay. But there is one exception. Okay, one exception. What is that? There is an autosomal trait for the microcephaly also. Similarly, there is another thing which is called as benign macrocephaly. What do you mean by benign macrocephaly, which is also called as megaloencephalopathy? Okay, so this benign macrocephaly, which is again due to the genetic cause. This is also an autosomal genetic trait which runs in families. All the family members are having big head size. That does not mean that they are having a developmental delay. This is one exception. But otherwise, in 99% of the cases, again we will have developmental delay when there is macrocephaly. Now, there is one more condition which is called as hydrocephalus. Now, whether macrocephaly is equal to hydrocephalus? No, it's different. Hydrocephaly is something related to the ventricular system of the brain, whereas macrocephaly may be because of brain parenchymal problem. There are so many issues where the brain parenchyma has undergone some accumulation, etc. It may be because of some of the storage disorders, it may be some of the metabolic disorders, etc. Now, looking at the hydrocephalus. Now, when a hydrocephalus, when it occurs in a 1-year-old baby, definitely it will be a very important differential diagnosis for macrocephaly. Okay, hydrocephalus, which is developing quite early in the first year of the life, may confuse with the macrocephaly at times. But this is one of the exceptions. There will be macrocephaly, that means head size will going to increase, but it is not pathology related to the brain parenchyma. It is pathology related to the ventricular system because of the fluid accumulation. Now, how to differentiate whether it's a macrocephaly or a hydrocephalus? Very simple. In these kids with the hydrocephalus, we will have a number of symptoms. Okay, number of symptoms will be there. Number one is there will be widening of the suture, and there will be symptoms of increased intracranial pressure. Child start with the sunset sign, Matchman sign, crackpot sign, and there will be increased symptoms of intracranial pressure, increased intracranial pressure. Boggy fontanelle will be seen. Okay, and these children are almost all nearly normal at the time of the birth, but later on this will begin. So these are some of the points which helps to differentiate the macrocephaly from the hydrocephalus. Okay, now at times this hydrocephalus may be secondary to achondroplasia, some of the genetic disorders. A child with achondroplasia may develop hydrocephalus, osteopetrosis, or maybe it is because of the communicative or non-communicative type of causes. Communicative hydrocephalus and non-communicative hydrocephalus causes are there. That may also lead to hydrocephalus, and some genetic disorder like osteopetrosis or genetic disorder like achondroplasia may also lead to hydrocephalus. A very narrow difference will be there in hydrocephalus and macrocephaly. Macrocephaly will have involvement of the brain parenchyma and other areas, but hydrocephalus has got involvement of only the ventricular system. Now, in conditions, there are some other conditions like neurodevelopmental disorders. Some other neurodevelopmental disorders which is very common in children. Many conditions are there. So many gray matter disorders and white matter disorders are there. And they may lead to macrocephaly. Storage disorders are there. Metabolic disorders are there. Okay. even some of the genetic disorders are there. Now, in conditions where there is neurodevelopmental disorders, commonly which is seen encountered is Tay-Sachs disease, then Canavan's disease. Canavan disease is a white matter disease. Okay, Tay-Sachs is I think it's a gray matter disease, and there are some syndromes like Alexander syndrome. There are some other syndromes like neurometabolic syndromes and some acidurias, metabolic, congenital, inborn errors of metabolism like acidurias, etc., organic aciduria, etc. So they may also present with macrocephaly. What is important is we can diagnose all these disorders at the earliest if you are measuring the head circumference. This is very important. Storage disorder also, you are before the manifestation of any of the symptoms of storage disorder in the brain, before that only you can diagnose that there is some problem if you are continuously taking the head circumference. So normally the head size, sometime especially in the first year, is very important. Suppose now you have got, in the first year of the life, you have got a doubt whether my baby's head size is normal or not. Okay, normal or not. So you can have a formula for the calculation of the same. It depends upon the length. That means if child is reasonably gaining the length, means height, then the expected level of the head circumference can be calculated. How it is? Length of the child in centimeter divided by 2 plus 9.5. Okay, so this gives the expected head circumference to the age. But this formula is only applicable up to first 2 years of the life. Preferably in the first 1 year, up to first 2 years of the life, this is applicable. Otherwise, it is not applicable. Okay, so this is all about the head size, microcephaly, macrocephaly. I have only touched the clinical point of view, clinical examination point of view. What are the cause of macrocephaly in detail? What are the cause of microcephaly in detail? There are so many things out there. But what is clinically for us, what is the importance of taking this head circumference in the pediatric practice? We should not miss any single patient. In every patient which visit to the pediatric OPD, we have to take the head circumference, especially in the first 2 years. What is the importance? I want to highlight that point. Therefore, this series of lectures of 3 parts has been done. Thank you very much. Hope you continue to support me. Thank you.